Doris is coming on. Come on. Come on, come on. Oh,
Hi.
here we go. What's happening? Did you see me okay?
I don't know
How's
what
my
happened.
hair?
Yeah, I was there before. I kept requesting, and
I think it
you
was
look
me.
so handsome.
Yeah, well, come on, I get dressed for you. You always look beautiful. I was just telling my office, please allow me to sit there and not blush and tell all my people how much I adore her. You know her already, Doris Day. We didn't train together. She doesn't look old at all, but she actually was my by 1 or 2 years. And we worked together for several NYU, Bellevue Health Center, doing cosmetic and general dermatology for many, many years. We've known each other for over 20 years now. And aside from practicing and having a very successful aesthetic practice, she travels the world, or maybe not now, but she travels the world teaching other dermatologists. She's a journalist as well, so she's an amazing writer, information provider. And like all good friends, we are allowed to disagree on things. And I wanted her to be my first kind of official debate because we've always had this inside joke about the product Sculptra. And I will say before the debate starts that when it first came out, I hated it. I said the company was going to go out of business. And somehow I found a use from it. I still have my strong opinions for it, but I want to let Dr. Day give a little bit about the science and how she uses it. Dr. Day, take it away. First of all, how are you?
Oh my,
Okay?
I'm good.
Right. So tell me about Sculptra.
Oh, Sculptra. Sculptra is made of an ingredient called poly-L-lactic acid. It's in the sugar family, and it was first FDA approved to treat something called lipoatrophy around HIV, which was, we saw a lot of fat loss and wasting in people who were on medication HIV and AIDS infections. So Sculptra was found to be really, really helpful in these patients. And what was really nice is that we were able to use it in pan-facial rejuvenation. And on the FDA labeling, it says it helps your body restore its own natural collagen. So the idea of this is that it's a stimulator of your body's own natural collagen. It's not a substance that's natural to the skin. There isn't a way to reverse it. So if it's done wrong or poorly, or if you react to it, you're kind of stuck with that. I mean, we have some ways around it, but the good thing is that it rarely happens.
Mm-hmm.
So if you follow the FDA approved labeling and guidelines, you're almost guaranteed to have problems
Yep.
because the way
Yes.
that it was FDA approved is not the way it should be used. But fortunately, we have brains and we have experience. And as we've learned to use this product, we've found ways to reconstitute it safer, to let it absorb water and hydrate itself, and then inject it in the proper planes of the skin in order to have beautiful natural outcomes. I said it to you, I tell the residents, I write it, and I'll say it over and over again. My Sculptra patients are my happiest patients because and those for whom Sculptra is the right product to use, which isn't all my patients. It's not even a majority of my patients. It's the patients who need it. They get beautiful contouring. I think of it as sort of making my palette and someone who's lost a lot of volume. And then you get to sculpt and contour over it with the hyaluronic acid and other fillers. So I use many fillers. I use actually all of them, but in one patient, I may use many different fillers.
Do you
So
mix? You mix Sculptra with other fillers?
not in, well, yeah, not in the same place on the
No,
same
not on the
day,
same face.
on the same face for sure. So my favorite place to use Sculptra is the temples because that's an area where you have to be a little bit careful because there's some vessels there you just don't want to inject into. And because it's these tiny particles suspended in water, you can inject it and really pull back on the syringe. And that still requires technique and safety. It's not 100% guarantee, but it improves my chances of knowing whether or not I'm in a vessel. And if I am, I know not to inject there. With some of the other fillers, you can pull back, but because they're so viscous, they're so thick and dense,
Yeah.
you can pull back, but you won't know, it won't give you much information back. There are places where you shouldn't use Sculptra. It's not designed for the lips. It's not designed for the lower eyelids, in my view. I would never use it there. I've seen problems of it being used there. And I've seen problems of it being injected too superficially.
You
So
ever
you
used it
don't,
here?
I don't like it there
Me
because
neither.
I think it creates bumps there. I don't use it in the hands either. So for those areas, I like Radiesse. I like even blended hyaluronic acid. So for the right person in the right place, it's an amazing product. And for
Yeah.
my patients with HIV lipoatrophy, it is life-changing.
Yes, 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 yes. Well, and how often would you say when
Are
you
we
tell
done?
people, no, would you tell, how long would you say I don't like telling patients how long something is going to last. I discuss how often I need to see you to keep you looking your best. So what would you tell your average patient? We know it ranges, what a maintenance.
You need sessions. Usually in the beginning, I might go at 3 to 4 week intervals and then 6 week intervals till we optimize. And the more treatments I do, the longer I wait in between, because I have patients who call and say, I don't see any difference. And then a month later, they go, oh my God, it kicked in. I'm so happy. I see
Yeah,
the difference. So there can be a lag between when we do the treatment and when you get the results. So the more treatments I do, the more I space it out. And then typically, in my experience, in most patients, it can last 1 to 3 to even 4 years.
yeah,
And I tell them it's not that they won't need other things in that time, because they may still lose volume and deflate in other ways. So we'll still do things. And I also believe that when I combine it with things like therapy and thermage, I get even longer lasting and improved benefits,
yeah,
because all of those are also stimulating.
yeah. So, and again, I'll give a little background to everybody here. Again, Doris and we disagreed. I'm not a fan, and I'll give you my reasons why I don't use Sculptra in the face. That being said, I am now a huge proponent of it in the body. And for many of my people in my audience, I use an enormous amount of Sculptra for buttock augmentation, body scar revision, cellulite, people who don't have fat to transfer into other areas. I use it as a very anyway, the point of the matter is that I find that it's very unpredictable. That's always been my main thing, and it is traumatic, and it does get expensive. Correct?
We would all agree with what?
That some people get a lot of effect, and some people get no effect.
Yeah, but when I have patients who have things like Voluma even, or strong high G prime, great solid lifting fillers, who tell me that they absorb it in a week or a month.
Yeah.
So I think that can be true of anything. And that's
Yeah.
where our patient selection comes in. And we have to be very careful to explain to patients that it may take several treatments. You may or may not get the benefit you want. We may have to combine it with other things.
Absolutely.
So somebody had written that they had 3 treatments with Sculptra and 3 thermage and no benefit.
Yeah.
So with those patients, I think it really helps to, and then somebody else wrote that they had 1 Sculptra. I don't think it's so much that it's unpredictable as it is that you have to be careful to both have proper patient selection, a proper conversation, and then take pictures.
Yeah. Do you use, so what I generally use for that type of biostimulation is I use hyperdilute radius. And the reason why I like it so much is that, to me, I find it much more predictable, less traumatic, less costly. You get an immediate and a long-term result. And if you hyperdilute it with a formula that I would use on the body, I get the same positive result, but it's just kind of like a little like 2.0 version. Not as much, I can get a lot more done in one treatment. I use so much radius in the face, and it's a natural substance found in the body, which I do like.
Well, it's natural to bone. It's not natural to the skin.
It's a precursor to cartilage and forms of soft tissue, but it does have biostimulatory.
Right. But don't you think that most fillers are biostimulatory? I think
Absolutely.
even just the act of injecting is biostimulatory.
Yeah,
so,
that's
and
true.
Especially if you use a cannula. So I think we're getting that benefit. But the idea of Sculptra is that you're leaving behind a very well-known entity. It's been around for a long time, over 15 years. And I think that if you inject it carefully and you have a good patient selection for it, and you have that conversation. And a lot of times I have patients who will tell me that they don't know that they see much of a benefit. And then we look at their pictures, and then all of a sudden they see. There is something about that gradual change that makes it so it's hard to tell. And the thing I see with Sculptra that maybe I see with Radius, but not always, is that the skin improves. Even though I'm injecting it deep,
you see it with Sculptra.
I see it with Sculptra.
You see it with Radius too. You do see it with Radius. You have to place it more superficially.
Can we say a shout out to Dr. Giacono? He's watching. Hi, Andrew.
Hey, Dr. Giacono.
I should show him the puppy. I got a new little Havanese from the same breeder, and oh my God, it's such love. Thank you.
Radius, if you hyperdilute it, you can use it more superficially. Like I use it on cellulite for the body, and you could do the same thing on the face.
I do too. I love that. I like it better than Sculptra on the body, actually, for cellulite and even for scars.
For cellulite, but it's not going to create volume.
No.
Jolene Edgar
Oh, I'd love
excellent beauty
to.
writer was there. She asked about what do you mean by traumatic, and I think you can agree. Um, Sculptra can be quite traumatic. Use a 25 gauge needle. And when I do hyperdilute radius, you could use a 28 gauge. It makes a big difference. Patients can do 3, 4 syringes of hyperdilute radius and go back to work most of the time. You cannot do that with Sculptra.
I beg to differ.
Really?
I don't find it traumatic at all. I find that you're essentially injecting something as thin as water. So if
Right.
you want to talk about injecting a product, I use a 25 gauge
Right. But
cannula to
25 gauge is
inject.
very traumatic. No?
I use 25 for everything. I don't use smaller cannulas because those are essentially like needles. So I think that for safer injections, I prefer a 23 or 25 gauge cannula. I don't find them to be so much traumatic as I think of that is just how the force of injection and it's more technique in that way. So if
Now,
you negotiate, you're not traumatizing so much.
now you use a cannula to inject Sculptra.
Almost everything. I mean, I use
Uh,
needles and cannulas. So if I'm injecting straight on bone with voluma for lifting or certain areas, I'll go with a needle. But in many cases, I'll use a cannula. Like in general, for hyaluronic acid for lip injections,
yeah.
I use 90% cannula.
Now, let's briefly talk about, and Dr. Giacono, who's a friend and an amazing facial plastic surgeon, one of my other caveats about Sculptra, people love talking about collagen stimulation, but, all these agents, including devices like Ultherapy and Thermage, they're not necessarily building collagen like we know collagen in a perfectly laid out form. You could essentially be building a form of scar tissue, which is a disorganized collagen as well. And I have found from many of the plastic surgeons I've worked with, including Dr. Giacono, that people who've had many rounds of
Yeah.
facelift, it could be quite difficult to do facelift surgery because of the scar tissue from multiple rounds of biostimulatory filler. Do you disagree?
Yes and no. I disagree that it's from Sculptra as a class, as a specific filler. So I happen to know from conversations with our dear colleague, Dr. Giacono, that patients who even have HA fillers can have the same issue. So I think sometimes it's the filler, it's how much they've had. It's a lot of different factors that can cause that. Sculptra, it's true. I agree. It makes it harder for the plastic surgeon, but my hope is they won't need the plastic surgeon.
Oh, that's
So
not true. Not everybody needs plastic surgery, but eventually
no,
the
I'm
things
kidding.
that cosmetic dermatologists do is a law of decreasing returns. The fillers last for so long. This is why I work so well with plastic surgeons, because the fact of the matter is you can't keep filling the tank. You can't keep neuromodulating and relaxing the muscle. And for some patients, they will accept that law of decreasing returns and just accept the aging process. But for many patients who have high expectations from their cosmetic procedures,
Right.
eventually they will gain a sense of disappointment and then consider
Yeah.
surgery of some sort. And I have found, because like you, I inject all the fillers, that although all of them can make surgery difficult, hands down, I have found that Sculptra is to be the most difficult. And most surgeons as well, cutting out skin cancers, going through Sculptra to remove skin cancers can also pose difficulty. And I have not found that as much with hyperdilute radius. But again, we can go on about this for hours because
No,
again,
but I'll say this.
yeah,
I would just like to throw in about Sculptra and the HA filler. So one thing's for sure, to your point, is that plastic surgery will always be here, and that at some point people may want to go that route. But I have many patients, and I refer to plastic surgeons every day. So there's that. But take the patients who say, I'll never have surgery. I want what I can do to help restore and balance, understanding that I'm going to get older. I don't know which category I fall into. Like, I'm
yeah.
hopeful that I can age and understand that things are going to happen that surgery may be able to fix, but I don't know that I'm necessarily going to want to.
Dr.
So there's,
Giacono, I'm ready. I'm ready.
yeah, I
Okay.
know. I
I'm
spoke to him about the
following
eyes
through.
already, so
Okay.
he
I'm ready
knows.
for it all.
Yeah. But the other point is too about HA fillers is you can dissolve them to some extent. So I don't know but even with dissolving, I've spoken with plastic surgeons, including Dr. Giacono, and I don't know that they believe that you can fully dissolve those because some of that disorganized collagen may be
Only
there
ones made by
anyway.
Allergan, by the way. Only ones made by Allergan, Vicross Technology. That's the farce of HA fillers, but that's another debate.
Yeah, well, that we can have that conversation. But HA fillers, and I do agree with you, we need to have studies on how easy or hard it is to dissolve different HA fillers. What is the best amount to use to dissolve them and what it really takes. But that, be that as it may, if you're talking about biostimulation and reorganizing collagen, and that it's not as natural as your own natural collagen, I don't know that you can necessarily dissolve fully the effect of the HA filler. You may be able to dissolve the filler, but not the effect.
I
And
agree.
so you may have that problem. And I think that makes it complicated for surgery anyway. But I don't worry about what's going to make surgery harder down the road. I want to do what's right for my patient today. And in many cases, Sculptra is the best thing for my patients because I've been doing it for 15 years. I see the outcomes. And I think that anything that you do over a long period of time, I do all my own injections in my office. And when I see the outcomes over time, I see what works, you naturally get better at it and your patients are naturally happier. So I think that if I saw that it wasn't working, and I know I have all the other fillers, I use all of them, I would have given it up by now. But patients are really, really happy with the outcomes. And even once you go for surgery, do fine.
Yeah. Well, I think we're both finding different tools to get the ball in the hole. The key is that we're both getting the ball in the hole with whatever combination. I have found, and I'm not going to suggest that you don't think about the long term for patients, because I know you do, but you did say about the short term. Because we're seeing so many patients at a younger level, they're doing any type of alteration. We've been doing this 20 plus years, Doris. I think people too much focus on the short term. I really try. I will have a 40-year-old have a discussion about whether or not in 20 years they would consider surgery. I want to map out the next 20 years. So to me, I think there's too much short-sightedness. And again, I'm not suggesting you are, but I think other providers out there, they are too short-sighted about immediate gratification, not thinking about the long run, whether it's hair transplantation and someone going totally cue ball in their history, or whether it's using too much filler in the cheek of a person in their 20s and what it could do to stretch out their skin. I think there's not
or
enough.
Or even just change how they see themselves, even just change their own vision of themselves. It's scary.
I'm very aggressive. I'm very aggressive in the manner of which I treat people, because a lot of people come to me, they may have seen other people. I want to do something that other people have not done. And that is often from a combination of a lot of things. But again, I don't know, I find Sculptra to be, there are a lot of other interchangeable tools now, I find. And, like you said, you've convinced me on Sculptra. I love it for the body. The good news for the company is that you need 10 times the amount. So even though I rarely inject it on the face, the company loves me because I use so much for the body. I will use it in the temples on occasion when my radius doesn't last long there. But I'm often, when I'm using volume in the face, I will use hyperdilute radius mixed with HA fillers. Same treatment, sometimes similar places, layering. And if I do need really long-term, if someone who has disease or true lipoatrophy, I'll use a permanent filler like a medical grade silicone. So
I would never use, I've just never used silicone. I would rather, I send those to you. I just won't use silicone
they're for people
because
with real medical issues. This is not for people who just want, I will use silicone for acne scars. I will occasionally use it for small amounts of lip augmentation, people with thin lips. I'll use it for body trauma of the face or body. And for people with medical lipoatrophy due to medications or HIV, it really is wonderful. And again, I have to say, in 20 years, it's still the only filler in my own hands I've never seen a reaction to. That's the crazy part. It's just, you have to do it so carefully.
In my 15 years of using Sculptra, I've never seen a reaction to it.
Yeah. Thank God, because you do it a lot. I will say this, you do occasionally, not at your hand, some people do get I still see some granulomas from Sculptra that I see maybe people aren't using their dilutions. I also get to see that with radius, and now I use the sodium thiosulfate, and it reverses granulomas from that biostimulator. Have you tried that?
I haven't tried it. I haven't needed it, but it's something that if I ever do, I will.
If you ever see it.
I've been following it. Yeah, if I ever see it. But also I find that I use only the radius that comes without lidocaine, and then I add my own lidocaine.
That's what I do.
The radius with lidocaine, I don't like that consistency, and I think that has more problems.
I agree, and I always dilute my radius. I have about 3 different dilutions I'll use for cellulite, for the face, for the hands, and I find it's great. So, that's it. So we could agree to disagree, but I think we kind of agree more than we disagree. I don't know. But
which is how we always end up.
I know.
But I was so happy because you had said Sculptra was going to be out of business.
we agree that we both like the way we do things, and that's okay. So,
Yeah,
and that's
and we're
it.
always learning, right? There's new
Always learning.
fillers out. I just always want to be, yeah.
Yeah. But
And that's one of the most important things.
what you were saying before about when Sculptra first came out, and that's when we first had the conversations, the FDA recommendations were completely different. And it's so true, and we use it completely differently now. And this is a word of wisdom to the audience that I know you'll agree. When a new product, a new device comes out, just because the FDA trials got approved for that doesn't mean that that manner of using it is going to be the best way in the long run. And you want to give new products and new procedures time so that the experts, people like Dr. Day and I, could really get clinical and anecdotal experience to find out what's in the best interest of the patient, which is why providers like Dr. Day and I change our mind about things, because we got to play around with it for a while. Things I hated 10 years ago, I now love, and vice versa, right?
Absolutely. Completely agree. And then even if I look at the way that I injected 2 years ago, I mean, there was a time when I looked at a cannula and I said, I'm never going to use a cannula. It looks, if you watch cannulas being used, it does look traumatic and aggressive. But when I started to use it, I realized that not only is it not that, it's actually a safer technique. You get oftentimes smoother outcomes. You can have way more control. And, you know, one of the new things I'm even realizing now is even the way you hold the syringe has such an impact on how the product goes in. So we learn one way, and you almost take things for granted about how you should do certain things. But as you inject, and you do liposuction and fat transfer, so you may be used to cannulas and injecting, you kind of hold the syringe differently. But the techniques of injection change over time.
Yeah.
And that goes from everything to how you hold the syringe, the type of needle or cannula, the size, the flexibility. There's so many variables beyond the product, the plane of skin in which you inject. Yeah. All of those things are constantly changing.
Which is why I don't think any one technique is good. If you have a doctor that only uses one technique, it's like only have a hammer, everything looks like a nail. I'm just looking at a few questions here. People asking about Bellafill, which is another permanent filler. I don't use it. If you're going to go permanent, use Silicon 1000. It's FDA approved. We use it off-label.
It has good data. I just don't use it.
It also has data of going on and off the market 3 times and has a much higher risk of complication. People are asking, let's see, plasma
about
pen.
Renuva and plasma pen. So Renuva is relatively new. That's supposed to be like a replacement for fat. And I think that's going to be a niche product. I am playing with it, experimenting, not on patients, but just learning about it, doing some advisory boards about it. So I think that it's going to be here to stay. It's interesting. I don't know if it's as reliable.
I actually use fat. So.
Somebody asked about fat also. You know, the problem I have with fat in the face is that it often looks like fat. And I don't know about you, but I've seen it act unpredictably, where when somebody gains weight, they just gain weight right there, depending on where the fat came from. And I don't like that it's unpredictable. And I that's one case where I feel like we have so many interchangeable fillers. Yeah. But if someone like our other follower here was saying that they had other treatments and they seem to dissolve it all so fast, that's when I think fat or even silicone might be an idea for them. Something
I do not use fat in the face that much anymore. I do not, because of the fillers.
Why?
I do for the same reason. Unpredictability. In a good patient, you get 50 to 75% retention. It may not retain equally throughout the face, and then you have unevenness. There are many stem cells in it. I mean, it's unpredictable. That's the simple answer. And again, I feel similarly. It's kind of the way I feel about Sculptra. I just find in my hands, I use the Radius Biostim products and the HAs, and it's a lot more controllable for me. But I do use an enormous amount of fat in the body. I use it for buttock augmentation. I micronize it and use nanofat for cellulite. I will always use fat in the body if I could, but I'm a liposuction guy. I'm a body contouring guy. Yeah. Fat is a great filler. It has stem cells. It does something amazing for the quality of the skin. It is the original filler and biostimulatory filler. But again, not everybody has the fat. It is more traumatic. It is more expensive.
I wish I could donate some.
Yeah, I know, right? And it's not a procedure that everyone performs. So
what about the plasma pen?
I've used some of the plasma pens. I did a trial for Cartessa Aesthetic with them. You know, it's kind of an electrocautery device. I don't like it for large areas.
No.
because it's too laborious. I have CO2 lasers and other things that are relatively equivalent that have less downtime. You can't wear makeup. You can't do anything with it. I will tell you where I love the plasma pen. I love it for
All right.
individual lines. I love it for individual glabellar lines. When you fill the nasolabial folds and you have that etched in line, you could use the plasma pen to go on either side of it. It's for static, non-fillable, non-neuromodulating lines. It's quick, it's easy, it's cost effective. But if you're gonna go through the week of downtime and the hour and a half to do around the eyes for a blef, go get a blef or do a CO2 laser and tighten that up in 15 minutes.
Yeah, I've seen scarring from it that's pretty awful. I mean,
Yeah,
I remember patients from England, it kind of made its way from there. Do you remember you and I were doing plasma, I don't know,
yeah,
nearly 20 years ago, really early in our practices? We had the original plasma device. And
yeah.
then when lasers became more reliable, I mean, I just think that it's really holding a flame to the skin and there
Yeah.
is a risk of scarring. And it really, really worries me when I see it being used so casually, as if it's a harmless device.
It's
You can
used,
scar and burn
yeah.
with it. I would not take it lightly.
It's generally used by a population that does not want to invest in technology.
Yeah.
That's it. They just don't want, you got to be cautious of med spas. And again, it's not that the plasma pen technology is bad. I just do not like the way it's being
No.
used out there. I really don't.
Right. Exactly.
I've used it on acne scars, rolling acne scars. I've injected silicone for the depth. I've used it to even out or plane acne scars, and it's worked very well. But again, it's something that I use for select people and for not broad areas. And you can only use it on type 1 and 2 skin, fair skin. That's it.
Right. Absolutely. And it
Anyway,
does have downtime.
I'm gonna let you go. It's been a half hour. This really wasn't that heated of a debate at all. I was hoping
No, we know
that
each other too well.
we'd throw some punches out there. Anyway, guys, the fact of the matter is this. I think Dr. Day and I can agree there is no best filler like there is no best procedure. There are indications from everything. What you need is to ask questions, see a provider that uses several different techniques and procedures to find the procedure that is best for you. And on that note, Dr. Day, I love you. I look forward to seeing you sooner than
Love
later,
you.
and I'll see you all later. Bye.